While many countries with confirmed cases of the coronavirus are taking several measures to reduce and prevent the spread of the pandemic, Nigeria doctors have decided to embark on an indefinite strike. Few hours after the third case of coronavirus was discovered in Lagos, the Association of Resident Doctors and Abuja chapter has announced their decision to embark on an indefinite strike. The president of ARD Abuja chapter, Roland Agboivo, in a statement said the reason for the strike was due to non-payment of more than 2 months' salaries after several warnings and ultimatums to the government. Agboivo said there have been inconsistencies and shortcomings following the compulsory migration of Integrated Payroll and Personnel Information (IPPS) for payment of salaries to workers. He further said members of the association have considered the current conditions of coronavirus and the effect it has on citizens before taking the decision, hence, the strike has to continue. 12th March, ASU also embarked on a 2-week warning strike for non-payment of salaries to lecturers who have not enrolled in the Integrated Payroll and Personnel Information. The federal government in 2016 came up with the idea of IPPIS so they have proper record keeping of personnel and also regulate and control the payment of salaries to workers to eradicate corrupt practices. President Muhammadu Buhari in January 2020 said the IPPIS policy has come to stay and urges all federal government workers to enroll. Dr. Osage Ehanire, Minister of Health, today announced the third case of coronavirus patients in Nigeria. Early hours of Tuesday, a 30-year-old woman who returned from the United Kingdom last Friday to Lagos developed symptoms of the virus and has been tested positive during 14 days isolation. He further said she is clinically stable and being attended to in the Infectious Disease Center, Lagos. Federal government has placed a travel ban on 13 countries with high-risk cases of coronavirus with effect from March 21, 2020. Announcing the ban, the Secretary to the Government of the Federation, Boss Mustafa, named the countries affected as China, UK, US, France, Italy, Japan, Iran, Switzerland, Norway, South Korea, Netherlands, Germany, and Spain. The SDF also announced that the federal government has suspended the visa on arrival policy. Commissioner for Health, Lagos State, Akin Abayomi, on Tuesday said contact tracking has commenced for passengers that travel alongside with the confirmed third case of coronavirus on British Airways. He said in quote, "We will be reaching out to the passengers of the flight as we did with the Indes case. But while we are making this public announcement, anybody who was on that flight as a passenger should reach out to the emergency numbers on the new toll-free number 0800 Corona." End of quotes. Michael Ryan, Executive Director, WHO, in a press briefing recognized Nigeria was taking precautionary measures so as to prevent the spread of the virus.
In Nigeria, for example, within 48 hours of the first case, Nigeria had established a 100-bed isolation unit. So, but I think the development of the clinical support and isolation services is uneven, and while it may be present at national level.
Senator representing Kwara Central, Senator Ibrahim Oloriegbe, during a session at the Senate, advises different measures to be considered by Nigerians so as to avoid eventuality.
Nigerians need to increase the observance of the practice of infection prevention control practices. This includes avoidance of shaking of hand. Also, we have to indulge in practicing hand washing frequently with soap for not less than 20 seconds. Except it is absolutely important, Nigerians should be advised not to travel from this country. What we've had so far are imported cases. We may have to consider disallowing non-Nigerians who are citizens of countries with high risk to enter our country. But in addition, sir, without doing that, our government, federal government, will need to increase capacity to screen people that are coming in because our borders are still open.
Ahmed Lawan, Senate President, also pointed out the need to create more testing centers in the country, especially in the southeast and north, so to take immediate action. He also said Federal Ministry of Health should come up with same standardized isolating centers throughout all states of the country.
there's need for federal government to do a little more, and that is in the area of testing centers. There is at the moment no testing center in the entire southeast. There is supposed to be a testing center in the southeast. At the moment, the entire north has no testing center. Abuja is Federal Capital Territory. We as an assembly, we are prepared to support the federal government if the request is for money, for resources. We are going to support it for those testing centers to be provided. Almost every state has established one isolation center or the other. I think the federal government, the federal Ministry of Health particularly, should come up with a standard. That standard should be replicated in all the states, even if it means the federal government will provide the technical assistance, so that states do not just establish isolation centers based on what they think.
The 12-member Presidential Task Force on COVID-19, which were inaugurated yesterday, chaired by Secretary to the Government of the Federation, Boss Mustafa, in their first meeting said, "There is a ban on all travel for public servants. We strongly discourage travel by Nigerians to affected countries except for essential trips. We encourage everyone returning to Nigeria from any country to self-isolate for 14 days. All those returning from countries where there is high, over 1,000 cases cumulatively, community transmission will be actively followed for 14 days by NCDC and Port Health Services."